Now we are going to look at the diuretics. Diuretics and their side effects. Okay. So just classifying the diuretics, there is a calcium anhydrase inhibitors, there is a loop diuretics, there is the thiazides, there is also the potassium sparing diuretics, as well as the osmotic diuretics. So we have seen there are 5 classes of diuretics. Now going under each one of them, looking at calcium carbonic anhydrase inhibitors. So here there is hypokalemia. Next there is also the metabolic acidosis. Acidosis. There is presence of the renal stones. Okay. Renal stones. And next there is also the hyperammonemia. And next there is the hypersensitivity as well as the bone marrow suppression. Next what we look is into the loop diuretics. So the loop diuretics, there is presence of hypokalemia. This is similar to the carbonic anhydrase inhibitors. And next is the metabolic alkalosis. So looking at the magnesium level, there is decrease in magnesium, there is increase in glucose, and there is increase in the uric acid. So what about the calcium? The calcium also dips down, and it can lead to the ototoxicity. Okay. And it is contraindicated with the aminoglycosides. Next we move on to the thiazides. So thiazides, it causes the hypokalemia, and it's very similar to the loop diuretics. There is metabolic alkalosis. And similar, the magnesium decreases, there is increase in the glucose as well as increase in the uric acid. The main difference being there is increase in the calcium, and the thiazide, it worsens the DM as well as the gout. Next we move on to the potassium sparing diuretics. So in potassium sparing diuretics, there is increase in the potassium. There is presence of metabolic acidosis. So in previous two, that is the loop diuretics and thiazides, we saw it is alkalosis. So there is presence of gynecomastia in case of potassium sparing diuretics, and this is mainly due to the spironolactone. Next we look at the osmotic diuretics. So in case of osmotic diuretics, there is presence of the hypo as well as the hyperkalemia, and there is also the hypo as well as the hypernatremia. So the potassium and the sodium level, it may increase or decrease, similar to the sodium. Next we look at the other, it can lead to the pulmonary edema. So even though it is used as a DOC for the cerebral edema, it can lead to the pulmonary edema.